In Canada, we know that 1 in 4 patients are readmitted to hospital within 3 months after hospital discharge. So we need to find ways to improve the way that we transition patients from the hospital into the community. The safety of our hospitals is a real challenge in healthcare, and we know that as many as 20,000 deaths in Canadian hospitals are preventable in any given year. So we need to find ways of making care safer. We know that health systems aren't perfect and that there are a lot of shortcomings in systems, and these include challenges with continuity of care, challenges in patient satisfaction, and needing to make care patient-centered. So the W21C is here to really find ways of making our system better for its stakeholders.
W21C is a research program within the University of Calgary. We're conducting reliable and impartial research to help turn evidence into practice. W21C is a testbed for new technologies and services. We're trying to understand what the impact of innovation is so we can turn knowledge into practice.
It's incredibly exciting to be part of this research enterprise. W21C brings people together from a variety of disciplines, industries, and sectors to conduct research, and that inspires innovation. It allows us as researchers and clinicians to study issues facing us today so we can make things better for tomorrow.
W21C was one of the nation's first to build research right into a clinical facility. Thanks to our unique partnership with Alberta Health Services, we have the ability to conduct research directly on a hospital ward. This living lab allows us to carry out research steps away from the patients that will benefit most. Together, we work to find information that's valuable, not only for our own communities, but for communities around the world.
I like working at W21C because I get to work with other researchers, clinicians, sociologists, engineers, as well as patients. We all work together on projects from the concept to commercialization.
There are a number of challenges facing our healthcare system today. How do we prevent the spread of infections in our hospitals? How do we integrate new technologies into our healthcare system to enhance patient safety and quality of care? What can we do to design better patient care spaces? Spaces in the ambulance for transportation, spaces in the acute care setting, spaces in the emergency room, and then ultimately spaces in the home. As a research organization, we're dedicated to finding solutions to these problems.
Dedicated to excellence.
Dedicated to caring for others.
Dedicated to making care better.